Thank you very much, and good morning, Speaker. My question is for the Deputy Premier. Residents in northeastern Ontario didn't need the Auditor General to tell us the LHIN has done a terrible job delivering health care. But thanks to the Auditor, she's confirmed what Northerners are feeling. The North East LHIN was tied for the worst in the province, meeting just 4 of the 15 targets. They are worst in alternate level of care days, second worst in wait times for CCAC in-home services, and they're one of only 2 LHINs not meeting the target of providing cancer care surgery within 84 days. The ineptness of the North East LHIN is nothing new, just sad to see that it still continues. I ask the Deputy Premier, Speaker, what is her plan to improve health care for Northerners?
Thank you. Deputy Premier.
The Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker. And I know it's the agenda of the member opposite and his party to get rid of the LHINs and fire the workers that are providing that integrated health care and coordinating health care at the local level. And I know it's the mandate and the aim of the party opposite to dissolve the LHIN boards that are comprised of local community members who, frankly, Mr. Speaker, best know what the unique and specific health care needs of those communities are. So, Mr. Speaker, the Auditor General has pointed to some important recommendations where we need to improve the functioning of the LHINs. We intend to take those recommendations very seriously, Mr. Speaker. We will invest in those recommendations to ensure that the quality of care and the level of integration is what it needs to be, Mr. Speaker. But I'm not going to go down the path that the member opposite wants to go down, Mr. Speaker. We believe in the importance of local decision-making, and we will continue to support that.
Thank you. Supplementary.
Back to the Deputy Premier. Well, Speaker, they're the only party firing 350 healthcare workers in the city of North Bay. In 2012, the North East LHIN met 0 of their 15 performance targets. Any other organization would have made management changes immediately. But what did they do at the North East LHIN instead? They spent over $750,000 to renovate their offices. The auditor was clear. She said, quote, the ministry does not consistently hold LHINs accountable when they do not meet their targets. Well, no kidding. Deputy, the buck stops with your government. I ask the Speaker, what change does the government plan to make sure that the North East LHIN ensures health care dollars are spent on patients, not on leather chairs and fancy drinks?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Well, Mr. Speaker, I know that the member opposite has an agenda to discredit the LHINs, to eventually result in their dissolution. We don't subscribe to that view. We actually believe of the paramount importance that we give local decision makers to a community board.
Finish, please.
Where we give decision-making responsibilities to a...
Stop the clock. The member from Renfrew, Nipissing, Pembroke. Warren. No, we have all kinds of time. It's not just 4 seconds. It can be any time. Finish, please.
To give that responsibility to local decision makers, Mr. Speaker, we've increased the funding to the North East LHIN to over $1.4 billion this year. Our funding for CCACs has increased by 50%. Despite what the PCs would like the public to believe, we have a strong record of providing quality health care in the northern part of this province, Mr. Speaker.
Thank you.